All right, guys. So we're going to go over the shoulder girdle today from the Manual of Structural Kinesiology by R.T. Floyd. Bones. Scapula and the clavicle move as a unit. Clavicle's articulation with sternum is only bonely linked to the axial skeleton. Key bony landmarks. The manubrium, the clavicle, the coracoid process, the acromion process, the glenoid fossa, the lateral border, inferior angle, the medial border. So you can see the picture right here on the scapula. So here's the inferior angle, the lateral border, the manubrium, the clavicle, the coracoid process, and the acromion process, and the glenoid fossa. Key bony landmarks on the posterior scapula: the acromion process, the glenoid fossa, the lateral border, inferior angle, medial border, superior angle, the spine of the scapula. So here's the acromion process, the glenoid fossa, the lateral border, inferior angle, medial border, superior angle, and the spine of the scapula. Joints. Shoulder girdle contains the scapulothoracic. The scapula moves on the rib cage. Joint motion occurs at the sternoclavicular joint and to a lesser amount at the acromioclavicular joint. So here's the sternoclavicular joint right here, and sometimes and to a lesser amount at the acromioclavicular joint. It's right there. Sternoclavicular. So multi-axial arthrodial classification, movements in relation to the manubrium. The clavicle moves anteriorly 15 degrees with protraction, posteriorly 15 degrees with retraction, superiorly 45 degrees with elevation, inferiorly 5 degrees with depression, some slight rotary gliding movements. Sternoclavicular. Ligamented support anteriorly by the anterior SC ligament, posteriorly by the posterior SC ligament. Osteoclavicular and intraclavicular ligaments provide stability against superior displacement. The acromioclavicular, also known as the AC joint, arthrodial classification, 20 to 30 degree total gliding and rotational motion accompanying other shoulder girdle and shoulder joint motions, supported by the coracoclavicular ligaments located on the conoid and the trapezoid, and superior acromioclavicular ligament, also the inferior acromioclavicular ligament. And it's most often injured, mostly when you fall on your side or something runs into you. Scapulothoracic joint. It's not a true synovial joint. It has a little bit of movement. Does not have irregular synovial features, and movement depends on the AC and the SC joints, which allows the scapula to move. 25 degrees of abduction and adduction, 60 degrees upward and downward rotation, 55 degrees of elevation and depression, and it's supported dynamically by its muscles. No ligamentous support. So some of the movements. Shoulder girdle movements equals scapula movements. So right here is the scapula, and deep inside the pectoralis major and minor is the scapula here. So this is where the movements take place. Wherever the scapula goes, the clavicle will follow, and vice versa. The shoulder joint and the shoulder girdle work together in carrying out upper extremity activities. The shoulder girdle movement is not dependent upon the shoulder joint and its muscles. Shoulder girdle muscles. They stabilize scapula so the shoulder joint muscles will have a stable base from which to exert force from moving the humerus. Contract to maintain scapula in a relatively static position during shoulder joint actions. And they contract to move shoulder girdle into enhanced movement of upper extremity when shoulder goes through extreme ranges of motion. Shoulder girdle movements. There's the scapula. Elevation. This is when the scapula moves up, kind of like when you shrug your shoulders. Depression. It's when you shrug your shoulders and then you go back down, or if you try to push your shoulders to the ground. abduction. With abduction, this is away from the body. It's like if you're raising your hand to ask a question. And with that abduction, there's also adduction when you have your question answered and you put your hand down. Also, with the abduction, when you're raising your hand, you get some upward rotation of the scapula. That way, it has to move so your arm can keep going up. And then once you're down with that, with the adduction going down after you have your question answered, the downward rotation from the scapula coming back from the upward rotation. Some of the muscles. The 5 muscles primarily involved in shoulder girdle movements. All originate on axial skeleton and insert on the scapula under clavicle. Do not attach to humerus and do not cause shoulder joint actions. Essential in providing dynamic stability of the scapula so it can serve as a relative base of support for shoulder joint activities such as throwing, batting, and blocking. Scapular muscles. They are important in spinal posture. Forward shoulder due to scapular protractors and depressors becoming stronger and tighter and retractors becoming weaker. Contributes to kyphosis. Less functional position for glenohumeral joint. Important to maintain lumbar lordosis and keep head over trunk in balanced position. So kyphosis is the forward shoulder rotation. It's kind of like when you're in your phone all day and you push your shoulders forward. They want to be back and upward. And good posture enhances easier inspiration. Inspiration as in breathing. Good posture makes it easier to breathe. So there's 5 muscles primarily involved in shoulder girdle movements. Trapezius, upper, lower, middle, lower. Trapezius is going to be located right here. It's kind of like a T. It comes down here. A little bit over here as well. The rhomboids. The rhomboids are going to be in here. The rhomboid major and the rhomboid minor. The levator scapulae is going to be right here. It helps with scapular levitation or shrugging your shoulders. Serratus anterior is deep in here. You're not really going to see it because it's on the front, and this is a posterior picture. Pectoralis minor, it's also on the front or anterior, and it's deep to the pectoralis major. Location and action, posterior and laterally. So here's the serratus anterior. Provides an abduction and upward rotation, kind of like raising your hand. Location and action anterior. Here's the pectoralis major on top of the pectoralis minor. There's the serratus anterior right here. So pectoralis minor helps with abduction, downward rotation, and depression. Pectoralis minor right here. Subclavius is for depression, pulling that arm back. It's right below the clavicle. Below clavius, clavicle, below the clavicle. Helps with depression. Location and action, posterior muscles. Here's a trapezius. Kind of looks like a T. Here, here. The upper fiber is elevation and extension of the head. The middle fiber is elevation, adduction, and upper rotation. Lower fiber is adduction, depression, and upper rotation. The rhomboids. The rhomboid major, rhomboid minor. Adduction, downward rotation, and elevation. The levator scapulae. Elevation of the scapula. Just some facts about the trapezius muscle. So the upper fibers, like I said, elevation of the scapula, extension and rotation of the head. You have the upper fibers. Middle fibers, elevation, upward rotation, and adduction. And the lower fibers, depression, adduction, and upward rotation of the scapula. The levator scapulae elevates the medial margin of the scapula. There it is. Rhomboid muscles, major and minor. Rhomboid major and minor muscles work together. Adduction, retraction, draw scapula toward the spinal column. These are used to bring it back into your body. Add, downward rotation from upward rotated position. They draw scapula in downward rotation. Here they are, pulling it back down. And an elevation, slight upward movement accompanying adduction. So as your arm comes back into your body, it goes back with just a little bit up, back to where it was. Serratus anterior, abduction or protraction, draws medial border of scapula away from the vertebrae.